Hey everybody, and welcome to the MMOA podcast brought to you by the Institute of Clinical Excellence. My name is Csepe, and I'm coming to you tonight to talk all about inflammaging. So what is inflammaging? How do we explain it to our patients? And how do we address this clinically? So I'm going to give you a quick spoiler update. I did a virtual ICE 2 months ago or so on this topic. And if you're not sure what virtual ICEs are, it's actually a really cool thing that ICE offers to class participants who have taken a live course for 3 months after a live course purchase. And it's basically an hour weekly long lecture style mentorship where you can ask the lecture presenter about any specific topic that they've prepared for months, preparing an hour worth of content, which is worthwhile for CEUs. It's a really awesome thing that our company is recently providing to our students. And if you have never listened to a Vice, I think it would be really well worth your time. We have different presentations from lots of different presenters from our pelvic floor, our older adult, our fitness athlete divisions, and many more to help really support those in our profession to provide the best care to our patients. And I did a presentation or a Vice on inflammaging several months ago because it's something that I'm really passionate about. And so tonight what we're going to be doing is taking a quick snippet of this inflammaging Vice that I did a month ago and talking about it in a 10-minute synopsis with a lot less overview of the research in a really digestible way to take it to your patients. So we're going to be talking about what inflammaging is, how do we explain it to our patients, and some really practical ways that we can help treat it in the clinic. So first, what is inflammaging? So this is something that's typical in aging individuals, but inflammaging is that chronic low-grade inflammation that we see in our aging population that can really increase our risk factor for cardiovascular disease, diabetes, dementia, sarcopenia, frailty, lots of different health complications across multiple body systems, and it's basically cell death. And you might think, well, isn't that just normal aging? No, several different factors can increase this cell death and senescence across our lifespan, and there are things that we can do about it. And unfortunately, certain health conditions and environmental factors are likely to make this inflammaging condition worse. So it's something that's measurable, looking at tissue necrosis factor alpha and C-reactive protein, different lab values that are probably in your patient's annual physical blood work that you can overview with them. And it's basically how much of your body is not able to recover and in a state of chronic low-grade inflammation, causing debility and causal relationships with multiple different body systems. The different potential mechanisms include genetic factors, central obesity, increased gut permeability, and changes to microbiome composition. So this, explaining it to patients, the real take home here is that, everybody thinks, okay, as you get older, you feel worse. Yeah, there's some truth to that chronic inflammation comes with a cost at how you feel. And if you're experiencing that inflammation constantly, or it could be related to that constant feeling of achiness in your joints, that brain fog, that feeling like you can't focus, this inflammaging and treating it is what is basically the fountain of youth. How do we chase feeling good for longer? And is this inflammaging inevitable? No, it's not inevitable. And the great news about this new study is that there is something we can do about it. Yeah, genetics play a small role, but we're looking at how much we can do to prevent inflammaging in our patients with lifestyle choices. And there's actually some really exciting stuff, and you don't have to spend buku bucks on supplements or different spa treatments to really capture something that makes us feel younger for longer. So that inflammaging, what we can explain to our patients, is related to pain, arthritis, fatigue, and risk of diseases. And that continued focus in research is because we now live longer. We really want to be able to manage inflammaging for a long time. The unfortunate thing And something that I'm really passionate about is that inflammaging and obesity often go hand in hand. Central obesity and obesity overall in inflammaging go hand in hand. It's something that I've brought up in almost every opportunity that I've ever had the mic, either on virtual ice or our podcast, is that obesity isn't just a disease, it's the disease. It's understanding that adipose tissue, this is something that I really popped off on my most recent Vice, is that obesity isn't just a disease, it's the disease. And if you only think about obesity as a fat mass disease, or understanding obesity as a way that adipose tissue puts excess pressure on our body, you're really missing a huge half of the picture. And the take-home message, the quick message about this is that adipose tissue isn't just inert. It's not just storage tissue. It's metabolically active. And so the more adipose tissue we have, the constant chemical messages we're sending to the rest of our tissues. And inordinate, disproportionate number of messages we're sending out from that adipose tissue can increase our risk for many different disease processes, including cancer, heart disease, diabetes, sleep apnea, all of these not from a pressure standpoint or a mass standpoint, but because this adipose tissue is sending out constant information to the rest of our body systems. And so a big part of it, and I'm sorry for upselling this Vice thing that we are now offering to our live course students, this is something that I'm really excited about. And if you want to hear more, please check out that Vice, which you would have access to if you signed up for our Vice opportunity that we've recently just started. Understanding that obesity has clinical consequences and that new treatment options are exciting, not just to treat the actual amount of fat, but those chemically mediated processes that we see in patients with obesity are changing. So if I can give you some quick take homes for how obesity management and inflammaging management can look to rehab professionals, I've got some exciting news. Number one, exercise is incredibly helpful at managing that chronic low-grade inflammation that makes our patients feel like dog crap. So the great take-home medicine is that you don't need to go to a med spa and do some sort of crazy cleanse. You can help your patients feel better today with intense, moderate to vigorous exercise starting now. With exercise, that is the most important thing that we can sell to our patients. You can feel better with exercise. It's not something that's just a checklist on your day of a to-do. It's the way that you will feel better. It's not a burden on your day. It's your relief from your symptoms. It's a global anti-inflammatory effect on your health. Exercise isn't just a good thing for you to do. It's what your body needs to flush out the inflammation in multiple body systems. So we have seen research time and time again show us that exercise decreases those C-reactive proteins or those tumor necrosis factor alpha levels in our bloodstream. We can see that exercise turns down the volume on our inflammation, which is great news for our patients, not just seniors, but those also with obesity. So exercise is the number one thing. Number two that we're going to talk about is diet. There are a lot of different factors in diet that we could talk about. I'm going to hit on some quick ones: reducing alcohol, decreasing ultra-processed foods, and increasing fiber. Man, our clinic has been on fire with fiber since I've done this Vice, because it's all we talk about now is how important adding fiber in can be to decreasing our global inflammation. It decreases that fiber or that inflammation by flushing out that inflammation through our gut. And high fiber diets have their systematic reviews that suggest that higher fiber, higher veggie diets help to decrease our inflammation and make us feel better on a systemic level. So super exciting stuff. The third thing that I want to talk about, and you saw it coming, is that with obesity management, with medications, we see improvement in these inflammation levels. So exciting new stuff for all of your patients that are on GLP-1 medications. They're likely going to see a decrease in that inflammation. And patients on these medications, listen, team, I know we have some real nuanced conversations to have about these medications. Are patients being prescribed these medications getting enough education from their team about potential risk of losing muscle? Patients getting this information, really doing something and being supported in lifestyle factors when they're taking medications from a multidisciplinary team. Are we seeing that? Not just in theory, but in practice in our patients. I understand that we have a lot of conversations to have about GLP-1 medications, but here's the truth. These medications decrease that inflammation. Patients who are on these meds feel better because not just from the aesthetic perspective of losing weight and feeling better and finally feeling like they've overcome this major burden of their health that they've been struggling for decades. They feel better because the inflammation that's been negatively impacting their health is coming down, because these medications help to curb their appetite, help to change how their body digests food, changes how their brain feels about hunger, and with that change and management of their obesity, that adipose tissue has less of a grip on their body's systems, which is an exciting and really good thing. So the take-home messages for our conversation tonight. Number one, the opportunity to get 3 months of Vice through your live course is super cool. Number two, Inflammaging affects a lot of our patients, especially seniors, especially those with obesity. And the better we can help support our patients in controlling this, the better they're going to feel. And the lower likelihood they'll have diseases like heart attacks, dementia, and kidney disease. We can help support our patients in several different ways. Supporting our patients, number one, should be in exercise. Exercise comes with so many other different benefits to our cardiovascular system, maintaining our muscles and our bones. And if exercise were a pill, everybody would want it because there are so many different ways that it can support our health. We can support our patients in their nutritional changes, and we should, especially in advocating for fiber, which helps to decrease our patients' global inflammation. And number three, we need to understand that some new medications on the market have a potential to help decrease our patients' global inflammation. So thank you guys so much for joining this discussion with me, and I love talking about this, and I feel so honored to have other clinicians link arms with me who also care. So thank you so much for joining me on this week's podcast, and hopefully we'll hear from each other soon.